Now, one of my favorite mantras that I give people is it's like this now. It's like, just notice, just be in this. Like, this is what I have choice in. This is what I have control over. And it's like, just look around. What is this? And it's not the past, it's not the future, right? There's that great Lao Tzu, when you're anxious, you're in the future. When you're depressed, you're in the past. When you're at peace, you're in the present. It's like most thises are really tolerable. And there's lots of choices within it. And if you want your next this to be better as a whole trajectory, not moment over moment, of course, but as a whole entire trajectory and arc, start making your choices in the this. And that's beautiful. I also like when you had your teacher, heart points, lung points. Little things add up. Little acupressure, little showing up, little making your choices within what to do at the gym, work some more, or do your own little workout. And the small and cumulative is where it's at. And that's all about education and choice.
Welcome, everyone, back to the Yosan University 39 Gen podcast. I have an awesome guest with me today. Now, would you like to tell people who you are and a little bit about what you do?
Yeah, thanks for having me, Sean. My name is Nicole Lange, and I am an acupuncturist. I'm very excited to geek out on TCM here with your listeners and with you. And I, more specifically, have been doing exclusive fertility and trauma work for the past 20 years. So I work in Minneapolis, Minnesota, and I am so in love with this work, and I'm really excited to be here to talk about it.
That's awesome. Um, and just so everyone knows, apologize to any listeners. Both of us are dealing with some wind cold attacks today. I was down for the count all weekend, but luckily back got some herbs in me and feeling on the mend. But if there's any sniffles or sneezing, just so you
Sneeze at
know,
it. Same.
that's where we're at. But Nicole, it's great to have you on, and I wanted to ask you a question. You've got this trauma and fertility work that you were doing, but let's take it back. I want to get into that. But how did you even find this medicine? How did you start going down this path originally?
It's such a wild story. I am not your typical acupuncture student, at least at the time that I went to acupuncture school, I was not. I think it's getting more diverse as time goes on and as medicine broadens and gets more evidence based and accepted. But when I went to school, I started in 2003. I literally had three acupuncture treatments from a chiropractor. And
Uh,
I wasn't steeped in the medicine. I was on antibiotics monthly for colds and tonsillitis and strep throat. And I was just pretty much desperate myself and curious. I loved Western medicine. I thought I was going to study genetics originally.
mm,
And then my own trauma, my own sort of upheaval in life got me to where I had been stabilized and sort of my life was literally saved by Western medicine. But then that was as far as it could take me. So I came to acupuncture school and I landed with a bunch of people that really knew it and had lived it and were brought up with it. And then they graciously accepted me with my Doritos and my lunch and not knowing any of it. And I'm so grateful. And thinking about being on your show, it just makes me so grateful for all the teachers and all the other people in this community that I'm in it with.
right. There is that, and there is this like, and I will say that I am also glad that you're talking about this. I am glad that there is a higher level of diversity coming into the program now because there is this story in the West of people who um found Chinese medicine for a long time. I read like a 90s martial arts movie.
Uh huh.
Martial artist was injured, went and found this old guy who gave them some herbs and they got better, which is rad that worked. And
Yeah.
it's awesome that was a way that many people found the medicine. But like now we are getting a more diverse group of people that are coming in and finding it for their different reasons, which is awesome because it brings a larger amount of personal experience and wisdom to the medicine as well. Like there is something to be said for people who've had more varied experiences. And one of the things that you were talking about with trauma too, and I've always felt that people don't always understand that word. And especially now when trauma has more of a weighted vocabulary, and people just don't understand how people are using the word trauma. It's interesting to me that when I'm doing yoga or sometimes when I'll be doing acupuncture, I'll have this memory pop up that is of an event or a time. I remember there was one time I was getting acupuncture done. I remember I had this event that I was in a martial arts group, and there were 300 people present, and I said the name of the head of the school's wife's name wrong. Her name is Nayla. I called her Naela. And she came over and everyone laughed when I said her name. And then she came over and pulled me aside. She's like, Sean, you've been here a long time. My name's Nayla. And I said, and I don't know why, but that stuck with me for a long time. And I just forgot it, shoved it aside. But years later, I was doing yoga and I just was leaning and breathing into this point. And actually, I just started an acupuncture. And then I went and worked through it with yoga and my acupuncturist. And it was just like suddenly this popped up. It just popped up. And I was just like, well, what is that event? And my acupuncturist was smart enough to go, well, that's a place that you're holding some trauma. That's something that affected you deeply. And I was like, well, isn't trauma like a more traumatic event? Doesn't it have to be something that's much more severe than that? And he's like, no, 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 no. Trauma can be any type of event that you've carried with you that is left you with this feeling of excessive dis-ease, and then that's the problem, is because if that stays and those things stay, they percolate and they turn into something much bigger down the road, if you're not working through that.
Yeah, I think that's such a great story. And when people ask me, how do I define trauma? Of course, there's the, you know, diagnostic manual definition, but
Yeah,
I think of it as how things can live in our bodies and our chi and our nervous systems, whatever sort of philosophy you land in, however you want to talk about it. It's the things that live in our body that are incredibly taxing and stagnating from a Chinese medicine perspective. And so
yes,
it can be the acute trauma that is the PTSD stereotypical like flashbacks and associations and things like that. But it can be things like what you're describing, where it's like this thing kind of lives in the energetic junk drawer of my body and it's taking chi and it's stagnating chi to be there. And so I love that we're in this moment where somatic therapies, whether it's trauma informed therapy with psychologists and social workers, or acupuncture work or yoga therapy is becoming more and more of a mainstream way of dealing with trauma because it is really evidence based and it works.
yeah. How did you know everyone goes to acupuncture school, and definitely the different schools, the different programs have varied styles in their teaching, and different professors make a huge difference, like whoever you're studying with. I mean, for me, I still have this deep love for herbs, and the way I look at herbs is definitely rooted in one person. Cormac was my professor in Los Angeles, and the way he viewed herbs and formulas and their pairing, I still don't have a copy of his book, but his book on modules is probably one of the best things I ever read back in the
Yeah.
day when I was in school. And I know they have a copy of that at Yosan and Cormac. If you're listening, dude, you need to do another printing of your book, please. But the thing is that that from that standardized education, people will then find their niche, their path, their direction. I was talking to one of my favorite episodes was talking to oh my goodness, Masin Al-Kafaji, who's one of the people who wrote the acupuncture book with Peter Dedman, like that everyone uses. And he's a skin guy. He does skin. That is his thing. And then other people are doing peds, other people are doing fertility. How did you find fertility and trauma as your niche and the direction that you wanted to go?
Yeah, so I was really in love with medicine, science and mainstream medicine as I knew it. And so when I was going through my master's degree program, I wanted to find all the science and the research that kind of went along with, and that's a very ethnocentric way of doing it, but that was where I was coming from. That was my worldview. And because of my own trauma, it was rooted in childhood ACEs and emotional traumas and things like that, and also sexual assault. That was kind of the catalyst where I became aware of a lot of other things. And so I really was interested in reproductive sexual health and trauma. So I was going through this lens and trying to absorb as much as I could from my amazing teachers and the lens of TCM, and then learning as much as I could about PTSD and trauma and sexual assault and all of these things and marrying them together. So when I was an intern, I had a really astute supervisor who was like, you might want to just think a little bit more broad and get a little more sort of holistic and Chinese medicine about it because you're not a psychologist and you don't want to market yourself as such. And so I was like, okay, I'm just going to do Shen work and reproductive health, like the where it bumps into that. And anybody else who seeks out my care and is not asking for things that I think bump into those areas, I'm going to refer out and I'll just see what happens. And I was newly married at the time, and my husband's like, "Are you sure you don't just wanna take any patient who wants to see you?" And I said, "I'll get a part-time job if I need to. I just wanna spend a year just saying yes to the people that really fit what I feel passionate and comfortable and confident in at that point." And by 6 months, I had a wait list because the way that I was practicing was unique and really steeped in a deep knowledge and really passionate. And those patients that I ended up saying yes to ended up being a lot of reproductive health fertility. And as the word of mouth generated, it just got to be that was what I was known for.
One of the things that I think, this is something I love, and I love that people, and I hope that we can on this podcast get more business based type stuff too. And I'll explain what I mean here. I have my own business, and I took during my acupuncture training, I took a sabbatical and did my MBA. And one of the things that I learned was that a lot of the things that we think about business are wrong. And, there's a lot of different things that we think, um, yeah, get as many customers as you can. Well, that's always not always the right idea, because one of the things that's really important in a business and running your business is that those foundational clients, and I think that if anything could be told to me enough, is that your foundational clients are so, so, so important. And making sure that the people that you're working with are happy and are a match to you. And that's all the another thing to say. First of all, the people that you're building, the core that you're building, that word of mouth for most things is going to be more powerful than any marketing that you can put out. You can
1,000%.
you can market for days, you can have billboards and flyers, but the reality is one happy customer who's like, yeah, this person helped me, can change your business. I remember that in my early part of my business, I had one happy customer, and that person was just, they told everyone. They told everyone and anyone that, hey, Sean's doing this great media and podcasting. You should go talk to him. If you want something done, this is the guy to talk to. And I was having people coming out of the woodwork to come on my podcasts and come on to things. And I was just like, wow, this is awesome. Um, and the other thing that I realized as well early on, and this is something that I stand by, um, is that not everyone is a fit for me. Not everyone is a right fit for me and the business and the services I offer. And it might be that they've got a ton of money, but it is not about that. It is about the match. And I think this is even more profound with a medical practitioner. Like when you are seeking out a healer, when you are seeking a as a patient, you want someone that can get you, who can understand you, who can hear you. I have a podcast called, and it's actually my biggest podcast. It's called the Growing Money with Sean Trace podcast. It is a personal finance podcast where I look from an idiot's perspective at money because I'm not that guy who's like, all right, I've got my solo 401k, I've got my Roth IRA. Like when I was early on, I was sitting there going, what is that? I don't know what these terms mean. And why I bring this up is because I talk to hundreds of people about being, personal finance and all that. But suddenly, one day, there was one guest who came on, and I was like, this guy's it. And I was like, what do you mean? And I talked to my wife. I was like, I met my financial planner today. I met the guy who's going to help me get my stuff in order. And sure enough, I messaged him. We started working together. And he just had this calm, chill, peaceful perspective to make me feel safe. And it's like, well, hang on, why do you need to feel safe? Dude, money is traumatizing for many
It's
people.
very triggering. It's like got a
Yeah.
lot of energy.
And the thing is like why bringing it back to acupuncture and business and all that is that you as a practitioner are the perfect match for certain types of patients, but you have to figure out who they are and how to find them. And sometimes it's as much about knowing what it is that you want to be treating as anything else. I had this one guy in my class. He was a Brazilian jiu-jitsu guy, martial artist. He had big earrings that he was a style in and of itself. He's such a cool guy. And he was like, dude, I want to do sports acupuncture. And I was like, well, I mean, I can see why, but why? And he's like, because I want to treat people that had the same problems I had. And he did. And he was hugely successful. Not because he wanted to do, not because he wanted to treat acupuncture, but he wanted to treat people with his problems because he knew those problems.
Yep. And for my own story, oh, you're making me think like 1,000 different directions that we could go with this. First of all, I'm a unique blend. I come from a family of entrepreneurs and business owners, and my grandpa was a motivational speaker. That's part of how I decided to take that leap into acupuncture school, because I he said this thing about like just put out a goal, not in a manifesting way, but in a like your brain is going to connect the dots. It's the most powerful supercomputer. No one could ever rival it. And so I made it my goal. I said, I want to do something that really uses the things that I'm passionate about and good at. And if you would have told me that that would have ended at acupuncture for trauma and fertility, I would have been like, you're crazy. But one step led to the next. And it's like, I love education. I love writing. I love science. I'm passionate about my own healing journey. You put all this together, and that's exactly what I do. And so it is so important to know yourself and to be true to that and authentic to that. And when I was in school, I saw a quote that was attributed to Sun Sin Meow, and it said, "A superior physician doesn't just treat disease, but teaches society and helps change the intentions of humanity." And that was my
Oh,
first sort of formative quote, right? It's like the
oh,
hair stood up on my arms. I was like, okay, that's what I want to do. Like,
yeah,
okay, I really like science. I want to do trauma and sexual wellness. And I want to educate and change people's intentions. So I started at that point doing talks once a month anywhere that would have me, just on the assumption, okay, I know a little bit more than the people at the Lions Club. Let's start there. I know a little bit more than these moms in this mom group about holistic medicine. Even if I'm a novice, I think education is a really important part for me. And so when you put all these things together, it's like the jujitsu guy, he has his own constellation of characteristics, and we each do. And if we can just stand in that place, there's a really cheesy story that one of my business practice management teachers
do
read about
tell.
being a being a lighthouse. Like if you're chasing around on an island, all the ships are going to crash into one another and sink. But if you can just stand your ground and send out that beam and let the ships kind of navigate around that, you're gonna help people. You're gonna serve people. And so that was a part of my story. That was part of where I was like, I'll get a part-time job. I want to be this lighthouse. And it is cheesy, but it works. And it is so nourishing. I think a lot of people think of fertility and trauma work as potentially very depleting. Never for one second have I felt depleted in this 20 years of doing this, because that's what it is to me, not chasing after trying to fix people.
Yeah. The Wow, there's a lot of fun to go there. The direction that I was feeling though too is I wanted to come back to honoring your journey, like, and talking about that. How have you um found ways to recharge yourself while you are working with people that need help being recharged? You know what I mean? Like, like, because what you were saying, a lot of people will feel burned out and such. How do you keep yourself full? What is your way of keeping yourself in an even keel while you're treating all of these patients?
Yeah. I have an early on story, and then I have where I am in my career now story. I was thinking about the early on when I was listening to an episode that you had about boundaries and empathy. And, uh, and when I started in the student clinic, I would get whatever I treated. If I was treating a headache, I would get a headache. If I was treating a bum knee, I'd get a sore knee for a couple
Yeah.
hours. And I talked to one of my professors and I was so embarrassed. I was like, oh my gosh, I'm this psychosomatic. I'm just like, just a nutcase, right? And my professor, thankfully, was so compassionate. She said, you're just very empathetic and you're being like a sponge. And you need to put on your lab coat. As a student intern, we wore lab coats. And that is your little protective armor. That is, I'm going to show up and do a differential diagnosis and take the pulses and have this interaction. And then I'm going to do the work that I need to do without taking it in any further than these cuffs and, the lab coat. And the second I started doing that, it was wild to me because as you can probably gather, I'm not all about the like energy of it. I didn't think of it in that terms. Immediately it stopped. I stopped getting whatever I was treating. So I think it's really important for new students to not look at being totally open as as a good thing and
Right.
listen to your episode about boundaries and empathy and think about rituals like that. And now as a 20-year practitioner, I don't have to think about it for a second and I really don't have to think about protecting my energy because I think the way that I practice is what I teach other people, which is sort of the ratios are different in what I do than what most people do. So for me, the ratios are about 25% troubleshooting and trying to go after issues. And 75% is about cultivating wellness. And it's like that's a very doable ratio. If 100% of my focus was on fixing problems, I would burn out in a month. And it is not in service to myself or my patients. So when I think about that's my ratio, that's my goal, that's where trauma healing happens. That's where optimal fertility outcomes happen. Not just getting pregnant, but having healthy pregnancies, then that is so infinitely doable and so joyful and so compassionate and humane that it's just like fun and amazing to practice this way.
Well, two things on that. I got you. You touched on two interesting points, and I love both of them. One of the things for me is even before acupuncture school, I was such an empath, and I realized that when I was doing body work and massage. And there was one spa that I worked at that part of the uniform for massage therapist was like a full apron on the front. You wore it, it came around the neck, and it tied at the waist. And one of the things that I found was that was the like I kind of viewed it as my armor. I would put that on, and then at the end of the day, I took it off. And it gave me this very clear separation. Um, so that I could kind of visualize. And even still, when I was in the clinic, I would be wearing the white coat around, but then I was like, I put the apron on in front, and the people are like, "Why are you wearing an apron?" And I was like, "It's just me, man. It just allows me to have this degree of visibility." And also, I was like, and I feel like I'm cooking in the kitchen, because when I go in there, and I know that sounds silly, but when I went in, whether it was herbs or this or that, you know, I was able to look at, every patient is like a cake that we're trying to bake, and there is the correct combination to make this person feel optimally well. And that's again coming back to your talk, like, you know, in the ancient medicine, certainly there was a huge focus on treating illness, but there was also a massive focus on wellness. You go to Sun Tzu Miao and all of these other masters, and like nourishing life was a big deal. And so I love that this 25-75 split that you're talking about, because one of the things I think that is a disadvantage to students, and luckily I know a lot of my professors don't teach this way, but I think it's something that a lot of my classmates had kind of instilled into them was like, oh, I'm going to be treating sick people. If you really, really, I had one clinic that I observed at. It was an off-site clinic that I observed at when I was in living in San Diego. And what was interesting was that this clinic supervisor, this clinic, focused so much on wellness. You came in and they laid you down. You got immediately got a hot pack put on your back. It didn't matter what you were dealing with. They laid you down. You put on a hot pack on. 10 minutes later, they'd come in and you'd get an immediate 10-minute massage. And then after that, the doctor would quietly come in and do a like tongue and pulse reading, and then they would immediately put some quiet questions, peaceful questions, and the pulse had settled by that point in time. The person was kind of giving more of a baseline, not the running around stressed from their day, and he was able to get a really clear read. And then acupuncture needles went in for 30 minutes and then came back for another quick mini massage by the acupuncturist themselves. And you know what? 99% of his patients came back because, and it was weekly. They came back in because it was not just an acupuncture treatment. It was a whole vibe. Like, it was a whole vibe, and
That
they
sounds a
came
lot
back.
like my practice, and it is,
Talk
and
to me
it
about that.
well, I my visits are 75 minutes long. From the time I was in the student clinic, all my classmates were like, "Gosh, can we see more people? Can we go faster?" And I was like, "Hold on, I wanna go slower." I take the time to chat. My entire clinic is a vibe. That's part of the treatment.
Yep.
Everything about it is about what now through a trauma-informed lens I would call neuroception, which is just the idea that this is Stephen Porges' work. 4 times a second, we're scanning our internal organ reads, our external environment, and our relational connections in that moment to see if we're safe or not. So
Yeah.
everything about that clinic that you described is like, wait, you're safe, you're safe, you're safe. That builds a foundation where then you can get to the gut dysbiosis or the endocrine dysfunction or the whatever you want, however you want to put it, the yin deficiency in a way that the body is much more open and accepting and ready to heal in. And so, yeah, 75%, 25%, if I can make you feel safe, if I can slow down your heart rate, broaden your heart rate variability, make sure that you're getting touched, you're feeling heard, you're feeling seen. 75%. So for me, 25% is the troubleshooting, the fertility or the trauma, the hormone, the reductionistic microscope slide stuff, and translating that into the TCM differential diagnosis. And then 25% is foundation, I call it. So the 25% for my world troubleshooting is nursery, baby making stuff. Foundation is felt safety and the concepts that, you're here as a not a person to be fixed, but as a whole being that I'm going to enter in service to that wholeness and trust that that knows what it's doing.
Yes.
25% of it is about mind, body, the bigger context of whatever your main concern is in. So if it's menstrual stuff or if it's gut stuff, it still matters if you're anxious or your air conditioner's on the fritz or, nobody's sleeping in the bedroom. We want to work on the whole house, I call that. And then the final 25% is the community, the purpose, the what I call the neighborhood. And so it might be talking with your partner about financial stuff that you're stressed out about. That is one of the biggest things to work on your chi stagnation and your kidney depletion for your fertility. And that's really neighborhood, but that's going to make a ton more bang than me picking the perfect acupuncture points or the perfect herbal formula for that particular pattern. And so it's like baking a cake. And the cake is relational and foundational and reductionist and TCM all put together into the best recipe that is so unique to that person.
100%. And and that's the thing too is like we don't realize the power and the impact that we can have on someone's life just by making them feel better, by making them feel more healthy, feel them more well. And at the end of the day, the body knows how to heal. The body knows how to heal, and the body needs help to clear out some stuff, some stuck stuff. And that's it. Like there was a great book that I read, and I slaughter quotes all the time, but it was an acupuncture meridian therapy book. And I don't remember what was in the book, but I remember this first quote. And it was, and again, I'm going to slaughter it. But it said, if you look at the body, and an illness is like a knot, but the reality is that any knot can be untied if you are willing to look at that one point. Think about it. You have something that is all bundled up and it looks horrible from the outside. You're like, oh my goodness. Like before we started, I had my headphones that were all knotted up because I did not tie them or wrap them correctly. But what happened is that all I had to do was to find that one point. There was one point, and finally, after I looked at it, I was like, there it is. That's what's keeping the whole thing. And I loosened that, and boom, it unravels. But you have to find that one point of stuckness, and then if you can find that, then everything will relax, and you just have to be willing to look for that point.
Yeah. Yeah, and I would even say the one part that, like, maybe there's like a, I don't know, a snag in the rope or something, like, it keeps coming back to that because my experience is, especially with something as complicated as fertility and trauma, I can untangle a knot in an acupuncture treatment pretty effectively. I can reset the nervous system. I can get the chi unstuck. I can get it circulating. I can change the pulse. But if they walk out the door and get it right back into that knot over and over again. So that's where the 75% of, like, okay, but listen, you keep fighting about finances, or you're really stressed about this, or you hate your career, or you think that your identity hinges on something that you don't control, like life and death. Let's explore these things, and then it doesn't keep getting tangled in the same place, and then they need acupuncture less. And I'm not taking on that role of having to keep them untangled and keep untangling them over and over. So
Yeah.
again, it comes back to, like, not burning out and feeling really good about it when you approach it from that angle.
Where do you see yourself going in the next 10, 15 years with this path, this medicine?
Yeah. I mean, as my own body and life kind of unfold, it opens up different things. So I definitely have been more exploring the sides of Chinese medicine and patterns that I've never known in my body and in my patient
Right.
population as perimenopausal and menopausal and some of my past fertility patients coming back. So I I'm a lifelong lover. I could be of learning. I could be a student for forever. So that's really thrilling.
Right.
I've also, in 2020, I launched an online. This is a great thing to talk about on your show. So when I was asked to be a speaker at one of the largest North American conferences in fertility, for acupuncturists, maybe 2014, 15, and then
Yeah.
they reviewed the feedback and the questionnaires from prior symposiums, and they decided to cut all marketing classes from the future symposiums because the
Really?
NCCOM, the National Commission for Acupuncture and Oriental Medicine in the US, categorizes patient education as marketing. And it's the
Ugh.
only category of continuing education that is not required for continued licensure. And so we have ethics, we have safety, we have fundamentals of Chinese medicine, we have biomedicine, and we have marketing. And then, of course, our CPR class. The only one that's not required for recertification is marketing, which feels fair to me, but maybe not smart, but fair. But patient
Right.
education, patient
Right?
education is categorized by the NCCOM as marketing. And I almost lost my mind. So at that exact moment that I got that phone call, I was waiting to go in. I was in a parking structure for an IVF. And I said, you know who doesn't think this is marketing? Every single patient I've worked with for however many years into my career, 10 plus years at that point. And so I pivoted, and instead of teaching classes, I do have online CEUs for acupuncturists. But I pivoted my energy from trying to do more of those to creating an online program for fertility for patients directly. And so that launched in 2020, took me 5 years to build. And now I'm working on a book version of that I'm pitching to publishers because I really do think that this is what patients want and deserve, and it's what works. And I think it's unfortunate as a profession that this is where we've gotten to. We've gotten so sort of steeped in, I don't know, doctor centricness is the main root that I think of, that we don't think of what the patients can do for themselves, and education is That's the Sun Tzu Miao quote. It's not like PR director of Chinese medicine, Sun Tzu Miao. It's like a founding father of the ethics of Chinese medicine said a superior physician doesn't just treat disease, but teaches society and helps form the intentions of humanity. So it is my mission. And thank you for having me on the show to change the way that we think about it as a profession, to bring it to more people directly, but to really have hope for the future generations of practitioners that they get it too, because we can just, I mean, we have so many cool things that mainstream medicine can't do. And they have so many things that we can't do. So when you put them together, it really is the best of both worlds.
100%. I I live in Asia, and I've talked about this multiple times on the podcast. And one of the things that I like to see here is that the two medicines literally live hand in hand. It's not that there is this, oh, they're this, we're this. Like when you go to the hospitals, the TCM hospitals in Asia, it is a full integration. People are, you come in, you show them your labs, you're talking about this, they're ordering you more labs so they can see things and get a better snapshot, and then they treat with this and that, and then they say, but go and get your other treatments done. And it's powerful because, you know, every tool is different. Everything that every practitioner you're working with can offer you something different. And, and there's this understanding of that. But I love that what you were talking about, because at the end of the day, what we really need to be doing is to be educating our patients. Like that is the
Amen.
core. That's the core. I had someone that was a medical professional that I spoke with. My father had coronary artery disease. And when they went in, my dad had a bypass done, and he's been healthy and still healthy years and years and years later. But that wasn't what the doctor said. The doctor said most of the people in that ward would be back after their quadruple or quintuple bypass. They'd be back within a couple years. And I was like, why? And he says, because they don't stop what brought them here in the first place. And he says, the steak dinners 4 times a week, the heavy alcohol, the smoking. He's like, those things often continue. And they're like, oh, I've got a new lease on life. I've got a new, my heart is extended. And he's like, and what they don't realize is they just start go beating this one up too. They start like hammering away on this. And in like what he said and what my father said is like, we need more education. We don't need more. We need to, he says, a superior heart physician, a superior cardiologist is stopping people from even getting to this point. It's not the guy who's doing the surgeries. He's like, your superior cardiologist is a guy who doesn't let his patients get to the bypass surgery. He's the guy who's like, let's get you onto a heart healthy diet now. Let's get you onto this or that now. And like, it can be tough. It can be tough for a patient to change. I remember when I was in school, I got swine flu. And one of the side effects of getting swine flu was that it caused a post viral syndrome that I developed severe food allergies everything, to everything. And it was like for a- X number of years, I couldn't eat meat. I couldn't eat pretty much any processed foods. All I could eat was rice, beans, and vegetables. And I went to see one doctor, and he's like, what have you been eating for the past, what do you eat? And I said, rice, beans, and a diverse array of vegetables. And now I've been able to add back more fruits and even more vegetables. And I eat some breads and grains. And I was like, that's all I eat. And my doctor's like, you have the perfect diet. Like, and I was like,
Yeah.
I get all of these fruits and vegetables. I put them into a rice cooker. I cook my beans like fresh every couple days. And he's like, was it difficult? Because the doctor was like really intrigued by the diet that I was on. He's like, this is the perfect heart healthy diet. You've got it. And for a family with your family history, like this is how you should be eating. And he's like, was it difficult? I was like, at the beginning, it was horrible. You know, there's not a day that like I don't smell pizza and go, "Oh yeah. Oh yeah. I would love that." But my body's like, "No to cheese." It can't do it. And for me, it was easier, but, like, if someone could tell me, now that I'm older and I'm a father, when you're young, you don't really see the effects of that. But now people ask me, "Why do you work so hard? Why do you push so hard?" Because I've got this 9-year-old kid looking back at me that I need to be there for a long time for, that I need to be healthy for, that I need to be strong for. The other day, I was working really hard, and I started my own business earlier this year, and it was anybody who doesn't know, when you start a business, it is long hours when you're getting things going, getting things right, getting things started. It is a lot of work. And now I finally have things at a place that it's stabilized, thank goodness. Still would like to be growing my clientele, but stabilizing. And one of the things that I found was like I need to take care of my wellness. And it was just a choice. It was a choice to get back in the gym. And my daughter, I take her to Muay Thai class. And I was like, I asked the gym, I was like, I don't want to take her classes. I am not training to be an MMA fighter. I am not in that place, but I would love if, I'm a black belt in jujitsu and I studied Muay Thai. Can I pay to use the gym while my daughter's in her class? And they're like, sure. And I just said, this is time. It's habit stacking. This is literally habit stacking. I'm already at the gym with my daughter. Yep. Can I work out while I'm there? And I did, and it's been a game changer for me. Now, why I'm bringing that up is because even as a practitioner myself, I still had to educate myself. And it was about sitting there and going, what is it that I can do for my own wellness? How much more our patients need that? How much desperately they need the information. We go to school for what, 4 or 5 years to get all this? And our patients need it so much. So whoever's listening, it's not marketing. It is a core part of what we do is educating patients. It's a core part of our practice is nurturing life. And nurturing life begins with education.
Well, and you just gave so many good examples of holistic things within that, the idea of like context matters. Like you can have the same diet, but the context that you're putting it in makes it more or less tolerable, more or less joyful, more or less feel like a choice. And that alone is something that we can give to our patients when we're educating. They might not ever be able to tolerate cheese. That is something to grieve. But
Right?
you can validate that and say that that is legitimate and having authentic feelings is good and healthy and not clenchy and cheese stagnating. And you can reframe it and you can help them understand it and feel empowered. I have both endo and PCOS, as it turns out. And I've never looked at myself as somebody with infertility or as somebody who had things to fix. It was just like, well, when I live my life right and use all the tools, Eastern, Western, holistic, reductionist, I'm going to be the healthiest, best balanced, best quality of life person with PCOS and endo and a history of trauma that I have. My husband has a genetic deletion that demyelinates his peripheral nervous system. It's like we have such a good quality of life, even though there's some use that declines as his disease progresses. And that's, if I was trying to fix that with needles, again, come full back, I would burn out. But if I look at it as context and humanity and mind body medicine, there's so many places to succeed in that. And there's so many places to feel so good and so in control that then all of a sudden the things that you don't control are infinitely more tolerable. And that I think is our real goal as providers is to get our patients there because fixing every single genetic thing or every single diagnosis, not so much. And we're just going to be clenchy if we try to do that.
Yes. Life is, I had someone give this example on it, my financial podcast, like life is going down a river and you're in the canoe and there's no way to not be on that river. That is life. Whether you are on the boat or you're off the boat, you're going to be in the river. And the choices is that you can either A, resist it and like, what am I doing? Or you can learn to flow with it. And that is the beauty of Taoism. That's the wisdom of Tai Chi. That is the wisdom of Yin Yang, is about finding a balance on that river. And it can be, and there's two ways that people can do it. They can clench, they can fear, but there's always that when you look over and you see that guy. The other day I saw this video, and it was of someone going down a water slide, and all these people were like, ah, flying down the water slide. And then there was one guy who just came down and he was standing, and he was just standing, sliding down on 2 feet. And you're like, I want to tell him not to do that. But obviously, this person knows better than I do what they're doing in that water slide
Getting
right
a
now.
lot of views doing it too.
Yeah, right? And they right. And the thing is like, we can either learn to dance on this river, or we can, um, you know, fall down and start crying. And sometimes falling down and starting crying is the right choice.
Yeah.
But,
Sometimes I
you
cry
know,
in my canoe,
yeah, right. Cry in your canoe. But at the
throw my
same
oar
time,
in.
right? There is, but like as a practitioner, you have such a powerful ability to impact other people that are in their canoe as well. And, if you could go back and give your younger self some advice on this acupuncture journey, what advice would you give yourself?
It's hard because the me of today is just like a totally different person. It's like, it's like saying, I think I just had to become each incarnation of myself. So trust that you're going to change. The only constant is change, and go along for the ride. Every single version's got its unique delights and its unique challenges. When I was starting out and I was hardcore TCM, and I'll have a home birth and do everything naturally. Now I'm full swing into I'm going to use herbs and hormone replacement therapy, and there's beauty in the journey, and you are where you are. There's no point in trying to fight it because your conditions are what your conditions are, and you just, if you don't like it, change little conditions one at a time, and eventually you'll be 47 and in a different place.
I love that. I love that. You are where you are. I think that's about as deep as I think that's the wisdom that we need for everything in life. Wherever you're at, you're at. And certainly you can always find more peace in that moment, but you are where you are. I once had this it was a special type of therapy for acting, but it was not acting. It was called the Alexander technique. And it's a postural correction for actors. And then they found that when actors correct their posture, they can speak better. They share better. They project better. And it was just about finding the space in your body. And one of the interesting things is that when you have a session for the Alexander technique, they begin with just helping you relax. And my teacher came up and he was like lifting and moving me into place. And then he sat there and looked at me. He said, I want you to repeat after me. I have time. And I was just like, I have time. And it was just like everything relaxed because at the end of the day, we're rushing on to the next thing. We're rushing to some point, but there's really no rushing on the river. You are where you are.
Now, one of my favorite mantras that I give people is, it's like this now. It's like, just notice, just be in this. Like, this is what I have choice in. This is what I have control over. And it's like, just look around. What is this? And it's not the past, it's not the future, right? There's that great Lao Tzu: when you're anxious, you're in the future. When you're depressed, you're in the past. When you're at peace, you're in the present. It's like most thises are really tolerable, and there's lots of choices within it. And if you want your next this to be better as a whole trajectory, not moment over moment, of course, but as a whole entire trajectory and arc, start making your choices in the this. And that's beautiful. I also like when you had your teacher, heart points, lung points.
Right? 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 Definitely.
Little things add up. Little acupressure, little showing up, little making your choices within what to do at the gym, work some more, or do your own little workout. And the small and cumulative is where it's at. And that's all about education and choice.